Hi, today is Tuesday, August 25th, 2026. I got back from my Chinese trip, 10-day Chinese trip on Sunday morning, and I am back to reading an English article on a daily basis again. And today I just got things together and I am ready to follow my determination to read English articles. Today we are going to read interesting article about our teeth. This article is from Daily Pulse feed. Scientists have developed a protein-based gel that could help damaged tooth enamel rebuild its mineral structure. Enamel is the hard outer layer that protects our teeth. But once it is badly worn away, the human body cannot naturally replace it. This is why erosion can lead to sensitivity, decay, and eventually more complicated dental treatment. Researchers at the University of Nottingham, I think that's a UK university, Nottingham Hill, and their international collaborators created a fluoride-free gel inspired by the proteins that guide enamel formation during early development. When applied to a tooth, the material forms a thin, durable layer that fills tiny cracks and holes. The gel then attracts calcium and phosphate from saliva. So from saliva is the calcium and phosphate come out, encouraging new mineral growth that becomes integrated with existing enamel. Laboratory in UK, laboratory work showed that the repaired layer could restore structure and strengthen the tooth surface. The treatment is still moving from research toward wider clinical use, but the idea is remarkable. Instead of only covering damage, future dentistry may be able to help the tooth rebuild part of its own protective armor. I like that. I have cracks and holes in my teeth, and I lost many teeth already. I am 58 years old. Not because I was lazy in my hygiene, but when I was a college student, the senior year in my college, I clenched my jaws too hard to spite of myself, right? I was mad at myself. I was mad that I didn't perform well in academic review, and I was mad and I clenched my jaws, hating myself. So that's why my teeth became pressed too hard, and later, 20 years later, I began to lose the far right, the far left teeth first, and my middle teeth are strong, but what do you call the largest or thick teeth, they just came out. The gel then attracts, when applied to a tooth, the material forms a thin, durable layer that fills tiny cracks and holes. The gel then attracts calcium and phosphate from saliva, right? From saliva, calcium and phosphate, encouraging new mineral growth that becomes integrated with existing enamel. Laboratory work showed that repaired layer could restore structure and strengthen the tooth surface. Very good. So we'll read another article. This one is from Science Squad. Hashem Al-Ghali is the author. A 10-second liquid treatment stopped tooth decay in clinical trials without painful drilling or anesthesia. FDA approval is next. Going to the dentist for cavity treatments could soon become a pain-free experience for young children. A landmark clinical trial published in JAMA Pediatrics has demonstrated that saliva diamine fluoride, or SDF, a liquid painted onto teeth in just 10 seconds, successfully stops tooth decay without any drilling or numbing. The study, which followed 830 children under the age of 6 with severe cavities, found that a single application of SDF halted decay in 54% of treated baby teeth within 6 months, compared to just 22.5% in the placebo group. While the treatment leaves a permanent dark stain on the affected tooth, researchers emphasize its safety and efficacy as a game changer for pediatric oral health. A game changer, right? The treatment, but downside to that treatment is that the treatment leaves a permanent dark stain on the affected tooth. Well, I don't want my teeth become darkened, currently cleared by the FDA only for treating tooth sensitivity in adults. This robust new data is expected to pave the way for official pediatric regulatory approval. Beyond making dental visits less intimidating, widening access to SDF could fundamentally reform healthcare equity. Because the non-invasive treatment requires no specialized surgical equipment, experts suggest it could eventually be administered by pediatricians during routine checkups. Not dentists, but pediatricians. This shift would provide clinical preventive care to vulnerable and underserved communities where children often suffer from severe decay long before their first official visit to a dentist. Source: Fontana M. et al., 2026. Efficacy of silver diamine fluoride on young children with severe early childhood caries. A randomized clinical trial, JAMA Pediatrics, caries. So we go back and look up the word caries, right? I heard the word several times, but I cannot pinpoint exact meaning except that the rotten, cracked or whole teeth or tooth. So we go to dictionary, so I cannot find it. So instead, here it is. I go to Carrie, right? Male or female first name that was not what I was looking for, man. So I go to dictionary.com. Carry,
or
right?
carry, or carry,
What?
or carry.
Wow, hairy. Man, fuck that. I didn't know that it's pronounced hairy. So I type in. Yeah, sometimes I use expletives. I shouldn't, but it's becoming a habit, right? Carry. It has something to do with tooth. In dollar caries means a dollar carry, right? Dental caries, commonly known as cavities or tooth decay, is a disease where harmful bacteria in your mouth break down your teeth. This breakdown happens when bacteria feed on sugars and starches from the food and drinks you consume. As the bacteria feed, they produce acids that slowly dissolve the hard outer layer of your teeth. Dental caries, right? Dental caries. Well, that's it. Thanks for listening. Have a great Tuesday. Bye bye. Wow, what the.